A new report from Canadian Affairs is putting the spotlight on how Canada's care system treat those with brain injuries. The case of 28-year-old Julius Jarvie Clark was the focus of the reporting. And we were joined by Alexandra Keeler, a reporter with Canadian Affairs and the Centre for Responsible Drug Policy, to unpack Mr. Clark's experience.
Yeah, so this story centers on one 28-year-old Toronto man, Julius Jarvie Clark, and the uphill battle his family has faced getting him proper care. When he was just 14, he fell down a spiral staircase and suffered a catastrophic brain injury. He was in a coma for a week, and doctors at Toronto's Sick Kids Hospital and his family did not expect him to survive. But he did, and it was considered pretty miraculous. Physically, he recovered, but what followed was just years of mental health challenges, psychosis, addiction, and bouts of homelessness. He later developed schizophrenia. He lost his impulse control, and he just kind of spiraled. And through it all, the system just wasn't built to support him. His mother, Suzanne, she's tried everything. She's brought him home to live with her and her husband. She's bought him housing. She's begged services for help, but his complex combination of brain injury, addiction, and mental illness makes him too high functioning for some programs and then too sick for others. So he's just fallen through every crack. He's been evicted multiple times. He's lived on the streets. He's recently been kicked out of Fillmore's hotel where he was staying, and his mom says that he's probably going to start asking her for a tent. She worries that he's going to further decline, and she says that she doesn't know how long he's going to live.
We also asked Alexandra about the systemic issues that those who suffer from brain injuries are facing.
And Julius's case is quite unique, but the systemic issues that he's coming up against are apparently not. Experts told me that brain injuries are shockingly common, especially among people who are unhoused and who use substances, but they're rarely identified as having a brain injury. I spoke with Dr. Peter Selby. He's a senior scientist and medical consultant at CAMH here in Toronto. He told me that brain injuries are often missed in addiction and mental health settings, and that's because people with brain injuries might look normal, they might look fine, and they get misdiagnosed or labeled as being, unmotivated or treatment resistant. But what's really happening is their brains are injured. They need a totally different kind of care. I also spoke with a neuropsychologist, Dr. Carolyn Lemsky, who works with Julius and his mother. She's the clinical director of Community Head Injury Resource Services, also here in Toronto. And she's frustrated. She says the system needs to stop expecting people with severe brain injuries to recover the way others do. She says the goal can't always be rehabilitation in every case, so it should focus on stabilization, safety, long-term support. Actually, both she and Julius's mother likened cases like Julius's to an Alzheimer's patient. We don't push the elderly with dementia out of care homes and out onto the street to rehabilitate. We try to make their lives as safe and comfortable as possible. And they argue that that's probably the case in some of these unique brain injury cases. That's what's happening in Julius's case, and when he's left to his own devices, he's further harming himself and further degrading.
And lastly, we asked Alexandra what experts are saying needs to be changed to avoid cases like Mr. Clark.
So experts say what needs to happen urgently is more integrated models of care. So one that connects mental health and addiction and brain injury services. It needs to include earlier screening. It needs to, doesn't need to require someone to hit rock bottom or be in a total crisis before they get help or qualify for that help. They also say that we don't necessarily need more institutions, but we do need more controlled, supportive environments where people like Julius can stabilize and where treatment is consistent, where housing is safe and comes with support. Because right now, families are left to carry impossible burdens, and too many people like Julius and young people are being lost.